Welcome to Understanding Human Anatomy. In this video, I want to continue discussion of the pelvis. In previous video, I've discussed the pelvis from the posterior view. And in this video, I want to look at it from the anterior view. I'm going to start by sketching in the sacrum. Like so. And I will sketch in the anterior sacral foramina. And remember that these anterior sacral foramina are for the exit of the anterior rami of the sacral nerves, sacral spinal nerves. And then I want to sketch in the os coxae, and then the lip of the acetabulum, like so. And I'm going to continue on around and we're going to have the edge of the pubic bone where it joins with the contralateral pubic bone, and then we're going to have the pubic rami and the ischial tuberosity. There. And I'll sketch in the obturator foramen, and let me sketch in the pubic tubercle. And then I want you to realize that we're really looking at the superior surface of the pelvis, like so. And let me draw in just a little bit of the other side here, and I'll sketch in the pubic symphysis. And like I've done in previous diagrams, I'll indicate that the pubic symphysis is different by giving it a coloration, a light blue, but I'll draw some lines in as well to indicate that it is a fibrocartilaginous structure. In other words, that there's a lot of collagen in here, so we draw some fibers through here. So we'll leave it like this, clean it up a little bit. I'll start by putting some labels in. Now, notice that the orientation is a little bit different than you might expect. I've tried to draw this close to true anatomical position. And when the pelvis is sitting in the body, the anterior superior iliac spine is in the same vertical plane as the pubic tubercle. That means that if you took and placed the articulated pelvis up against the wall, you would put the anterior superior iliac spine, which I'll label here, the anterior superior iliac spine would be against the wall, and the pubic tubercle would also be against the wall, so that the obturator foramina and the pubic rami would actually be facing more inferiorly. Now, we'll label the pubic symphysis. Here. We have the obturator foramen. There, the anterior inferior iliac spine, at this position, we have the iliac crest, this edge here, we have the ischial tuberosity, right here. Next, I'm going to sketch in the femur, or at least the proximal portion of the femur. And I'm going to start down here at the head, and we can only see part of the head of the femur because most of the head of the femur is sitting in the acetabulum. So we have the head of the femur, the neck coming down here, and then we have the greater trochanter coming down like so, and the lesser trochanter coming back up and joining the neck. So there is the femur, and let me label a couple of the parts for you. The greater trochanter there. The neck of the femur, the head of the femur, there. Now, we need to look at some ligaments associated with the joints here. One of the joints is the amphiarthrosis that is called the pubic symphysis. And I really have exaggerated the size of the pubic symphysis. The two pubic bones are actually much closer together. I want to draw in a ligament between the sacrum and the iliac, and I'll color that ligament in. And this is the anterior sacroiliac ligament. And that is the ligament on the anterior side that is holding the sacroiliac joint together. And remember that the sacroiliac joint is a true synovial joint, although there is very little motion between the two bones because of the strong sacroiliac ligaments, anterior and posterior, and because the articular surfaces are not flat, but very bumpy, so that there's resistance, bone-on-bone contact when the bones try and move very far. I want to sketch in the obturator membrane, and I'm going to draw a little piece here to cordon off a small opening that will be the true foramen through which pass the obturator artery, vein, and nerve. But I'm going to color in the rest of the obturator foramen with the obturator membrane. And the obturator foramen is about 90% covered by this membrane, and this membrane will serve as origin for muscles, principally the obturator internus and obturator externus muscles. Then we will have a ligament running from the ilium to the femur, covering up the head of the femur, hiding it from our view. And let me color that ligament in. And that is the iliofemoral ligament. And then we have another ligament running from the pubic bones over to the femur. And this ligament is the pubofemoral ligament. And we'll label that. And the pubofemoral ligament, together with the iliofemoral ligament, and the iliofemoral ligament runs superiorly over the top of the joint, over the superior surface of the joint, around to the posterior, and then on the posterior we have the ischiofemoral ligament. These three ligaments together hold the hip joint together. They are the supporting ligaments for the joint. There is one other ligament that we never see in typical drawings, and that is the round ligament, or the ligament of the head of the femur. And this ligament which we cannot see is running directly through the joint from the os coxae into the head of the femur. And while it looks substantial, it's really not providing structure. What it is doing is carrying the blood vessels to the head of the femur so that that tissue can receive its nourishment. That completes our discussion of the anterior view of the pelvis. Thank you for your attention.